Dr. Tom Roselle live right now, 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio. Cold but beautiful outside. I hope you get a chance to get outside and see the leaves and walk around. Dr. Tom Roselle Live is here every Sunday at 12 o'clock to bring you the most updated information on alternative integrative healthcare from a structural, chemical, emotional point of view. Perhaps you've had a problem and you've tried, you've applied, you've done everything you can think of, and you've come up with everything that doesn't work. Well, here's your opportunity to find out what does work at 888-630-9625, 888-630-WMAL. We're broadcasting to you from 105.9 FM and AM 630 WMAL. Love to talk to you, no matter what the question might be. We have an interesting topic today, one that is going to kind of shock you a little bit, turn the lights on for some of you, and make you realize that you might need a little help in the application. And it's called herbs as medicine. And many of you have used herbal remedies and herbal preparations, and because somebody told you they work, so you went out and grabbed them and used them, and sometimes they work, but sometimes they have side effects just like other things do. They are natural things. They are natural remedies when used properly. However, there are a lot of considerations that you have to be aware of. This Wednesday evening, the 2nd of November, November 2nd, 2011, we are going to have an in-house presentation on herbs as medicine. And your host, your presenter, Dr. Stephanie Pina, as well as my guest today in studio, and we're going to be talking to you specifically about those things. Dr. Stephanie, welcome.
Thanks for having me again.
It's fun to have you again because you're easy to talk to and you're so knowledgeable. You have, more between those 2 years than, a lot of people do work in a lifetime at this stuff.
I hope so.
Yeah, well, when you combine a degree in naturopathy, a doctor in naturopathy, and an acupuncture degree, you have to come up with, something that's substantial. So I applaud you. And this is right up your field, and that's what we're going to talk about today is herbs. And we're going to, throughout the program, we're going to distinguish a little bit between American herbs and Chinese herbs and what the differences are, if any, and try to answer questions for any of our listeners that want to know more about it. But more importantly, this Wednesday evening, if those of you who would like to learn more about herbs and their applications and when to use them and when not to use them and so forth and so on, join Dr. Pina. Give our office a call at 703-698-7117. That's 703-698-7117. And tell my staff at the Roselle Center for Healing that you'd like to attend Dr. Pina's presentation. It's really going to be a great one. It's one that if you are, in that what works, what doesn't work, how does it work, when should I use this, this is something that you really should be present for. Attend that lecture, and all you got to do is 703-698-7117. Dr. Pina, let's start with something really basic and very simple and very straight up. Why are herbs medicine? Why should we consider that in spite of the traditional community saying they don't work?
Well, it's kind of interesting. Herbs and different types of plant forms of medicines have been around for a lot longer than any of the medications that we've been using. In fact, a lot of the medications have herbal bases. And essentially, whether it was using something topically or ingesting something as a tea, herbs have always kind of been there to kind of help support the body. They grow around us. They are living, breathing organisms, and we can use their extracts to really help treat a number of different conditions. Whether it's traditionally people looking at different herbs, the way they looked, the way they grew, and kind of saying, well, does that reflect something in my body? And it kind of grew from there, and nowadays you can actually see how the medical community is kind of changing, and you're seeing more and more reports, whether it's in the news or in magazines, about how individual herbs are used and how they're used in combinations with and without medication.
It's amazing to me. I've been using herbal preparations in practice since I started many years ago, before the dinosaurs ruled the earth. But truth of it is that herbal medicine goes back since the beginning of mankind. People trying to find ways to dull pain, to decrease inflammation, to set bones, to calm the stomach down, and so forth. And then, the problem is that when we see things that work, we try to figure out what is it within the substance that works, and then we adulterate the substance, the natural substance, the herb, if you will, and we make a medication out of it. And unfortunately, when you do it that way, then there's a tremendous amount of side effects because nature, in its endless amount of application, across the board, makes things to work harmoniously. So you take an herb like Valeria, which is a calmative, and it can be a tranquilizer, and a very effective one, which really doesn't have any side effects of monumental importance, but then they use the extract and they make Valium. And then Valium, as we know, is a drug that is extremely addictive and has tremendous amount of side effects. So let's talk a little bit about why herbal preparations are more effective. I'm going to take it from that vantage point, and how you use them as a practitioner on a day-to-day basis.
Well, it's interesting, like you're saying, the trend now is really to kind of help, especially with the Eastern herbs and stuff, the ones we hear a lot about, is to find that single thing that's in there. What's the active component that is helping us? How can we extract that and basically come up with the most potent thing possible to treat whatever symptoms? When I look at herbal use, and you can look at this traditionally from a Chinese medicine community, from the Ayurvedic community, they would use the whole herb. They saw the synergy, the parts that, whether included the plant, the whole plant, the flowers, the leaves, the seeds, the roots. When they looked at it, essentially what they wanted to do is kind of see how it affected the body. And different parts of those plants can have different effects on it. One might be an anti-inflammatory effect. One might have more of a strengthening tonic effect that would help out with the adrenal glands. So essentially, when we look at how we need to even take it and how's the best way to use this herb properly, we really need to see, well, how's it going to work in the body the best? If we do the whole herb as a powdered form, is it going to be easier to digest than if we use it as a tincture or as a capsule? And those might be important for, say, someone who wants to use an herbal medication and has digestive issues, and they're not going to be able to digest things the best. So you can really moderate how you use herbal formulas and also the different products based off of what the patient's really asking you about, what the problems are, and also you want to take into consideration how that herb's going to use in the body as well, too.
If we call them liquids, or we call them tinctures, or we call them phytochemistries, it basically comes down, it's all herbal therapies, and some of them work better in certain circumstances than others. I have found for my use that the liquid extracts generally have much more of an impact. They have a higher energetic, if you will. Some people say, well, it doesn't make a difference. Teas are used as well. When you use a hot tea, it opens up the energetic. In acupuncture, we would call it, there's more yang effect. There's more potency to it. However, you need to understand that there are differences. And, going back on what you said as far as, and what we began to talk about as far as they're taking an extract of the herb to find the one component within it that makes a difference. There's two sides to that situation. First of all, as I said, that when you use an herb, nature puts byproducts with it and allows it to work the best, and it allows the absorption, allows the effectiveness, allows it to have the most profound application in the body. But here's the other piece. When medicine sees an herb and they said, okay, there's an active component there, let's find out what the active component is. The reason they're trying to do that is, on the surface, they're telling you, let's find that one piece and make it work the best, because we can adapt it better. We can we know what the side effects are better. But here's the other piece: medicine cannot own an herb. They can't own an herb. They can own a formula. They can own an extract. They can patent an extract. They cannot patent an herb. And that's the reason that they do that. Unfortunately, as a result, the side effects start coming up, and the effectiveness sometimes cannot be controlled.
Absolutely, and it's kind of interesting. I think that's almost the herb's way of kind of giving back to us, too, because basically it's saying there's more to me than just this single extract. Whether you look at that from, when I look at the favorite formulas that I like to use it in granular form, so you have basically that mixture of almost like a coffee, instant coffee type of way of getting into the system. So it's a little bit different than doing it on tincture extract, and it's a little bit different than doing it in a tea extract. But essentially, you're getting the whole part of the herb, and you might be getting it with other herbs too that work together that you wouldn't get if you just pulled out that active ingredient. And by working together, they can work on different functions of the body. So that, say you're treating something that has inflammation. Well, maybe you want something that moves blood flow to an area to help decrease that inflammation, while you want something that's going to help decrease like the histamine system that essentially is causing some of the inflammation as well.
So no matter what the condition is, there's an herbal preparation. In true herbology, you look at the patient as it relates to very specific herbs. The herb is applied to the patient very much like a homeopathic remedy done under a constitutional level if you do it the right way, which means that you have to understand whether the patient is hot or the patient is cold, whether the patient is vibrant, how they assimilate things, what the chronicity of the condition is. Is it really truly acute, something that just happened? And the herbal preparations change accordingly. Now, when we talk about the application of herbs, and we let's talk about acute situations versus chronic. How would you distinguish different types of remedies based on that from herbology? And I mean, we're sitting here, people are saying, "Oh my God, I've got to worry about." They tell me that this works for this, but it may not work for this. But it's, so how would you do that?
Well, one, you want to, again, go back to that patient's constitution, see how long something's been going on for, because certain herbs are going to be effective in those acute situations, and certain ones you can take for long periods of time. You certainly we wouldn't want to give a really potent herb that's supposed to be one that you can use for a short amount of time over a long period of time. That can actually do more harm on the system. And you, as a practitioner, you always want to check back also with that patient. Did they have any side effects? Did something happen? How long have they been taking it? Because there are certain herbs out there that shouldn't be taken for long periods of time, and that's when people start to get into trouble. Essentially, what you want to do also is you might change up the way the person takes it in a form. So, like you're saying, tinctures, teas, when it's adding more heat to the body, you might want to make sure that they're doing it for a short period of time for acute situations, while something that might be easier to travel with, say, in a capsule form or a tablet form, might be something for more of a chronic long-term patient, because essentially they're going to have to make sure they take it on a regular basis for a longer period of time.
My guest in studio, your host this Wednesday evening, November the 2nd, at the Roselle Center for Healing, your presenter, Dr. Stephanie Pina. She's going to be talking about herbs as medicine. So if you'd like to learn more about how to take care of yourself and how to apply herbal medications, herbal remedies to your specific condition, this is something that you need to really attend and pay attention and take notes, and you'll go home with a whole bunch of things that you never thought were possible before. Give our office a call at 703-698-7117, 703-698-7117. Tell my staff that you'd like to attend Dr. Stephanie Pina's presentation on herbal medicine this Wednesday evening, November the 2nd. And you can give us a call right here at the studio today at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject. We've got a minute, and I want to springboard this into, we're going to talk about some very specific applications of herbs when we come back and into the next half. But define for me what an adaptogenic herb is.
An adaptogenic herb is kind of interesting. What it is it's an herb that if the system, no matter what system is in the body, if it's turned on too high, it wants to bring it down back to normal. If it's not functioning enough, it's hypofunctioning, it brings it back up. So essentially, it can work with a lot of different people, because essentially, if they're coming in and they're too strong, you need to decrease something, it can work that way too. So there's a number of adaptogenic herbs that are used in different formulas and for different applications.
So it's like an automatic rheostat.
Absolutely.
Turn it up or turn it down.
Exactly.
The body's brilliant. It takes what it needs to take and applies it appropriately. We're going to talk about adaptogenics, so we're going to talk about specific formulas. And if you have a question, we're here at 888-630-WMAL.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle, and you're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630-WMAL. My guest in studio, Dr. Stephanie Pina, who will be your host this Wednesday evening at 7:30 p.m. at the Roselle Center for Healing. She is going to be presenting a night on herbal medicine. If you'd like to know more about herbology and how to use it for yourself and how to apply it, this is an opportunity that you really shouldn't miss. Give our office a call at 703-698-7117 and tell them that you would like to attend. Additionally, we'd like to remind you that an ongoing sponsor of Dr. Tom Roselle Live is Thermography Centers, and you can check them out online at thermographycenters.com. Also, we want to remind you that you have 1 day left October, Breast Cancer Awareness Month, and thermographic imaging is one of the best things you can do to find the beginning stages of breast cancer by the development of the blood vessel supply to the mass 5 to 8 years before it shows up any other way. And thermography centers of Fairfax will, in the Fairfax office only, if you register by tomorrow, will give you a 20% discount on any thermographic scan. Give them a call and talk to Dareth Painter or register and just check them out. Thermography Centers of Fairfax. Dr. Pina, we have a call. Let's take it. It's on topic. Diane, how can we help you? Thank you for calling. Diane? Hello? Diane? Diane's not there, but she wants to know about her daughter. She has allergies to peanuts and wants to know if there's an herbal cure. You want to take a look at that?
Sure.
Sure.
Obviously, it's great to have the most information you can possibly find.
Diane, are you there?
Yes, I am.
Oh, okay. We were going to answer your question even without talking to you because I didn't hear you.
Well, good. I'm glad you are. Yes, my daughter's got a severe peanut allergy, and I've got all kinds of environmental allergies, and I was hoping that herbs could help with those.
Essentially, one of the best things to do first is really to kind of investigate a little bit more on what's going on with her allergy, and same thing with yours too, because obviously the body, no matter what the allergen that goes in, is having that reaction saying, you know what, I'm trying to get this out of my system. It's going to do the best it can. So whether it's creating more mucus or it's reacting, we want to make sure that there's certain things going on. What's her typical reaction? Is it right after she eats a peanut, or?
Well, we try to avoid peanuts, but she tends to get hives when she's in contact with any kind of peanut exposure.
So she has a high inflammatory reaction to the peanuts.
Right.
So essentially, when you look at something like that, obviously the body, like I said, it's having a reaction. It's almost like a red flag signal saying, hey, don't do this. Don't eat any more peanuts or any peanut products. Obviously, avoidance, the way you're doing it right now, is going to be the main thing, too. But herbs can be used for an inflammatory response by basically kind of helping to decrease histamine in the system. And that's what's creating the hive reaction, the redness. Simple things, one of the best ones that I like to use actually right away can be as simple as stinging nettles, which is urticaria.
Uh-huh.
And essentially what that does is it helps break down mast cells. So what it can do is kind of help decrease that inflammation locally, and also if it's affecting anywhere else in the system too. But it may not be enough, depending on how severe your allergies, to use it by itself. So you want to actually see what else is going on too.
Is that a topical treatment?
No.
Oh, okay.
No, that it would typically, in this type of situation, we were talking about maybe using a tincture and stuff to be basically more effective in an acute situation. This could be something that could be done, dosed out pretty small, put into a little water or something that she's drinking, and have her take it as either a capsule or in a tincture form. But it has to be based off of her size and weight as well too. You don't want her to take too much.
Diane, so the problem with any kind of allergic response pattern is that it's usually a multi-systemic type of situation. It's adrenal function, it's liver function, it's thymus, and the body's going into a protective mode to defend itself from the thing that's coming in. It's an immune depletion condition. Now, just for an FYI, if you want to see what happens and how we treat allergies, if you go into RoselleRadio.com,
okay.
On the right-hand border, you're going to see a picture of a young girl, redhead, that I treated in MTV Crew followed us for about 5-6 months. This girl was so profoundly allergic to everything that she would go into seizures and she would go into anaphylaxis on a weekly basis from the time she was 8 years old, and I started treating her when she was 17. It'll give you a real clear look at how we do things, but herbs are part of the process, and it's one that you have to identify which system is really being affected. If the adrenal system is part of the culprit, then you're going to use adaptogenics or things that are very specific to upregulate or even downregulate cortisol in the body. If you have an inflammatory process and the liver's not working, you may use an extract called Yakatron, which is an herbal liver remedy, and that works to bring down histamine. So there's a lot of different approaches, but you have to individualize it based on the patient. Diane, we're coming up to a break. Join us this Wednesday evening, and we can get real specific for you. Thank you for your call.
This is Dr. Tom Roselle, live, 105.9 FM and AM 630, WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. We are in studio, 888-630-9625, 888-630-WMAL. Love to talk to you on any subject you have in mind. We're talking about herbs and their applications as medicine. My guest in studio, Dr. Stephanie Pina, who will be your host this Wednesday evening, November the 2nd at 7:30 p.m. at the Roselle Center for Healing. Dr. Pina is going to be talking to you about herbs as medicine, and it's your opportunity, double whammy, today and Tuesday or Wednesday. So if you'd like to attend, and we encourage you to do so, if you really like to be able to use herbs appropriately, give our office a call at 703-698-7117, 703-698-7117. Tell my staff that you'd like to attend. These are public information seminars, our in-house continuing education programs, as we lovingly call them, and they're there for you. We do them to educate you, and we would like you to learn as much as possible to help yourself. All we do, though, is require a reservation. There's no charge, but a reservation is necessary. Once the room is full, it's full. So 703-698-7117. Dr. Pina, let's talk more specifically about herbs and their applications, and take it to a different level and answer whatever phone calls that may be applicable. American ginseng, Siberian ginseng, Panax ginseng, they're all ginsengs, but they're not the same, are they?
Oh, absolutely not. And in fact, even the way they're prepared, whether or not they're grown for a longer period of time or they're let dried for a longer period of time, can even change their effect in the body dramatically. Essentially, when you look at the ginseng family, there's one of the adaptogens that we talked about before, but essentially it's also in Chinese medicine used as a blood tonic. So they kind of looked at it from a different system. How do you improve blood and circulation? Well, you can also improve it by using ginseng as well. And each one of those ginseng types, the one you hear the most about is the Chinese or the Korean ginseng. And essentially it kind of performs by basically working as a tonic in the system, which means it kind of stimulates the body to basically put itself back in. It helps to keep cortisol levels more balanced by essentially not allowing it to be produced over and over again. And what it's doing at different levels and with different species is it's got different effectiveness levels. One, the American ginseng doesn't tend to be as stimulating as, say, the Chinese ginseng. And then even the Siberian ginseng is the one that you hear that Russian athletes used to use quite often to help with strength and stamina. Even that one doesn't work the same as the regular ginseng, the Chinese ginseng. So essentially what it's doing in the body is really helping to protect it, maintain stability and endurance, but essentially each one's a little bit different. So you want to make sure you actually use the right form with the right person, and also make sure that they're not using too much of it, because too much of a good thing, even with a great herb like ginseng, can be bad for the system.
It can be very bad for the system. Ginseng is one of those things that actually will burn the adrenal system out if it's used in excess. So you have to be careful whether you want to use it as an adaptogenic, an upregulator, or down. It's used as an aphrodisiac in some combinations as well. Again, you have to choose the most proper application of it. So all herbs aren't created equally. And the other piece about herbs, and we'll talk about that a little bit later on, is their purity, because we've gotten herbs from manufacturers that all of a sudden we found out that they were tainted, if you will. Years ago, there was a company that put out an herb that had high levels of arsenic, and several people died from them. So when you buy an herb, you want to make sure that they're grown organically. You want to make sure that they're pure, that they've been open to testing, that what you're getting in the herb is just the herb and there's nothing else, and that you know how to dose it. And, a little bit with herbs works. A lot with herbs sometimes gives you a counter effect. And those are the things that we have to look at very, very closely. Let's go to the phones. Anna, how can we help you?
Yes.
Anna?
Yes?
How can we help you? What's your question?
My question is, I have a very acute urinary retention, and I have a horrible mucus that I can't get rid of it all. I don't know what to do. My stomach also is huge because of all of the liquids that I take, and I cannot urinate them at all, very easily at all.
Now, Anna, let me ask you a couple quick questions. Are you on medications?
No, I'm not.
Okay.
At all. I don't believe in them.
Okay, are you constipated?
Yes, and I take Dulcolax.
You're taking Dulcolax to move. How much water are you drinking during the day?
I like to drink water. I would drink a whole liter of water a day or two.
Well, there's several things that you have to look at. Now, the mucus, is it that you're noticing the mucus when you have a bowel movement, when you go to the bathroom?
The mucus is 24 hours. I can't even sleep.
Okay, from your sinuses as well, then, correct?
I don't know. I've gone to all my doctors. They're giving me everything from Cysol to, and I don't take any more of that, to nose sprays, to washing my nose. It's worse. They make me worse, so I stop them.
So it sounds like your body is basically, that mucus is actually being produced as a protectant, but essentially we got to figure out what your body is responding to. And essentially what's happening is, the reason it's following in with the constipation is that it's almost like all that water and stuff that you're taking in goes right towards mucus production than actually going towards helping your stools become loose and more formed and getting them out.
Oh my God. So what do I do?
Well, the thing that is, there has to be an examination process to find out really what's going on. It may be abnormal bacterium that's in the intestinal tract that your body's reacting to. It could be simply that you're allergic to gluten. One of the primary symptoms of gluten intolerance is mucus, and from both ends of the body. It can be a dairy allergy.
What is gluten inside with?
Gluten is...
How do I get gluten?
Gluten is wheat and oats and barley and rye.
I do not take barley. I do not take oats because I have dysphagia and I cannot eat.
Do you eat bread?
No, I live off liquid soups.
Okay. So you may be getting something in the soups. You may be getting additives. There's a lot of checking that can be done to find out exactly. I'm going to give you something that you can try for immediate effect, and actually it's a homeopathic remedy.
Okay.
And if it's in your throat, it's called Kali sulfur.
Hold on 1 second. Kali, how do you spell it?
It's Kali sulfur.
Sorry?
Kali
Li
sulfur. SULPH. You can get it at any of the health food stores.
LLI and then SULPH.
2 words. Kali sulfur. Kali. And then SU.
I like sulfur.
Okay, and then just you go in and ask for that, and they'll give it to you. But give that a try, Anna, and you should find that will make a difference. The mucus can be extensive; it can come from a lot of different things. Generally, Dr. Pina, it's something that we see for a lot of conditions, but it's also what we have to really remember, and people need to remember. It's a side effect.
Absolutely. Like I said, your body is normally producing that mucus to basically coat and cover stuff. When it starts to become too much of a problem, too much inflammation, it doesn't know when to stop. So essentially, it can be a normal response, but we don't want it to overextend into other areas, causing respiratory issues and causing more inflammation in the body. So it gets really important to sit down and figure out what's the link with what's going on with the body.
We're here at 888-630-9625. That's 888-630-WMAL this Wednesday night, November the 2nd at 7:30 p.m. at the Roselle Center for Healing. Dr. Stephanie Pina will be your presenter at our in-house continuing education program. It's our gift to you. We'd love to have you as our guest, but we do need a reservation. Give us a call at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to be there, and I promise you're going to go home with some really basic fundamental applications and use of herbal remedies. To talk to us here, we're at 888-630-9625. Let's talk about more herbal specifics. A lot of patients have heart problems. And heart problems come in all forms and makeups and so forth. We can have hardening of the arteries. We can have a heart muscle that's weak. We can have a lack of output, production. But one of my favorite herbs to use for the heart is hawthornberry extract. And not just the powdered, but the extract itself in liquid form.
Yeah, hawthorn's been around for a long time, and it's kind of interesting. The same idea that we use it for cardiac issues is also used in Chinese medicine, but it's also used as a digestive formula in Chinese medicine. So it's kind of interesting how different cultures kind of use it in different ways. But essentially, hawthorn's interesting because what it does is it opens up those blood vessels and kind of helps to renew the elasticity also within the smaller blood vessels, so that can help regulate blood flow. It can also help regulate essentially the contraction of the heart. And it's something that people can take for a shorter period of time, notice the difference, but then they can also take it for a longer period of time, and it's not as detrimental on your system. But it is one that you want to monitor, obviously, if you're taking, say, heart medications as well, too.
Yeah, you have to be very careful with herbal preparations, using them if you are on any type of medication whatsoever, because herbs are powerful. They work very, very quickly, and they can enhance the medication that you're taking on. They can deplete the medications that you're taking on. So it's important that you talk to somebody like Dr. Pina, who understands the biochemistries, the intricacies, the interrelationships, and so forth. But hawthorn or hawthorn berry extract has been used to treat heart disease going back literally thousands of years, and it's a very effective circulatory enhancer, if you will, and it's used not only for heart but also respiratory conditions. If you have any of the things that we talked about, from high blood pressure to irregular heartbeat, hardening the arteries, heart failure, the leaves and the flowers are used, and they can have profound effects, but you also, again, have to be very careful. If you're taking other types of medications, these can work in contradiction to them or suppress them or enhance them. It's important that you do it judiciously. We're only putting it out there for information. We're not telling you to use that. We're just letting you know that there are options actually that heal. Dr. Pina, let's talk a little bit more about the heart and herbal preparations that work with blood pressure in the heart. In your experience, and in tremendous experience, the effectiveness of some of these herbs are amazing.
Absolutely. And it's interesting because you can rely on how the patient's actually feeling pretty quickly as far as how you want to dose out an herb or if you want to combine it in combination with things. But the heart's interesting too because essentially it's going to tell you right away whether or not it likes the herb or not. What I've seen is, a lot of people will come in questions about things that they've gotten over the counter that may contain things like garlic, ginseng, and essentially what they'll notice is that it tends to stimulate the heart more than relax it. Those things you have to be careful with because essentially that's their purpose. That's what they're trying to do. So if you use them in the wrong combinations, you really can run into some trouble really quickly. Other different things, there's another one out there that you see a lot of in Chinese medicine called Dan Shen, which is actually a great tonic where essentially it works on the smaller blood vessels as well as the heart itself too. So it's actually working on the blood vessels that feed the heart to allow it to function. Those are the ones that you hear about if they get blocked over time that really cause some of the heart attacks and stuff because essentially there's no blood going to the larger muscle that's pumping the blood. But essentially there's some great formulas out there that use things that in combination with Dan Shen and basically green tea and stuff. So you're getting the antioxidant factors, you're getting the vitamins and the minerals that are in the different herbs structures that essentially help promote health and healing in the heart but also decrease inflammation that might be causing other issues as well too.
The second best selling drug herb in Germany? Question, pop-up test.
I would say it's probably black cohosh.
Close. Garlic.
Garlic.
And garlic has a profound effect in many things, but also in cholesterol regulation, triglyceride regulation, decreasing blood pressure, increasing heart function. Extremely, extremely powerful. They like to use the dried form. I like the tincture. Looks like, once you've had it in your body, you may be a pizza factory, but other than that, but it primarily in Germany it's used for hardening the arteries, atherosclerosis, and high blood pressure, and it works extremely effective. Obviously they use it in combination with some other herbs, but they won't go without it. It's been around for a long time, and there's been a tremendous amount of double-blind studies that are done in the different medical institutions in Germany that show that garlic all by itself is extremely effective.
It's interesting that you bring up the smell on garlic because essentially the most active component when you do look at where it is, it's in that smell. So if you take out the smell of it and you get the odorless garlic, it's not going to be as effective. So they used to say, there's an old saying that essentially you have to have that smell in order for it to be effective. So I've seen some people go, no, I want to stay away from it. And I go, well, even if you're using it in cooking, it's got to be there. It's the sulfur component that's in that smell that's really affecting the body.
The other herb that they use in combination is motherwort, and that's often used with hawthorn berry extract in combinations with garlic. The combinations of those have profound effects. I've seen patients over the years that have gone on those herbs, and they've been able to substitute their medications that they've been on with better control than with the medications, and obviously the side effects aren't anywhere near as profound, but you still have to take each one of them in consideration. This Wednesday evening, Dr. Stephanie Pina will be your host at our in-house continuing education program. She's going to be talking about herbs as medicine. We encourage you to be there. If you'd like to join her, 703-698-7117.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been in studio at 888-630 WMAL, broadcasting to you from 105.9 FM and AM 630 WMAL. My guest in studio, Dr. Stephanie Pina, Doctor of Naturopathy and Acupuncturist. She will be your presenter this Wednesday evening at 7:30 p.m., November the 2nd, at the Roselle Center for Healing. We'd love to have you as our guest. All you need to do is give us a call to register at 703-698-7117. Dr. Pina, what are we going to learn from you Wednesday night?
Well, we're going to go over a lot of different aspects, basically, of herbal medicine because there is a lot to cover on there. We're going to start by looking at some of the historic uses on how different cultures have used herbs and essentially how they've been able to create that into a modern-day process as well. We're going to sit back and look at some of the popular herbs that you hear about on an almost everyday basis or you read in the news and really go over what their use might be, how do they work in combination, and why with some of the side effects and stuff that you heard in the past, why did they get the reputation that they did? How are people getting scared off by herbs, and how are they using them effectively? We're also going to go over different types of forms like the tinctures, the homeopathics, topical salves, and different things, how to use the best herb most appropriately for you and your situation, including I'm going to give basically a couple of ideas of things that you can keep at home so you don't have to worry about running out to the store every time if something happens, because there are definitely at-home remedies that can be effective that you don't have to worry about what the dosing is. Other things we can go over too is symptomatically how things affect different organ systems in the body. Everything from respiratory to immune to the adrenal system, even male and female reproductive systems as well too. How do we basically tie that in? So it's going to cover a lot of great information. We're going to answer some questions, figure out how herbs can be used best and most appropriately in the body, and then basically kind of give you some advice on how you might be able to really look at herbs from a different perspective next time you read about them in the news or you talk to your healthcare providers about using them.
Be there. Be there. You will learn more than you possibly could handle and walk away. 703-698-7117 is how you register for Dr. Pina's class. The problem with this program, it's way too short, and we have a whole lot more to add to the pot, and we just don't have the time. But you can get a hold of us at RoselleCenterForHealing.com or RoselleCare.com. See you next week. This is Dr. Tom Roselle.